Well, welcome everybody to the webinar here today. My name is Sarah Teague, and this is Treating the Addicted Professional, Practical Tools for the Discerning Clinician. So my name is Sarah Teague. I'm a licensed clinical professional counselor and also a certified alcohol and drug counselor, and I am the Director of Outpatient Services through Foundations Recovery Network in Chicago. So this is a webinar that's sponsored by Foundations Recovery Network. You can submit a question on the bottom left of your screen at any point during the presentation, and all questions will be answered during the last 10 minutes of the presentation. You'll also be able to find a PDF of the presentation and additional resources under the headshot image located on the left-hand side of your screen. And for any additional assistance, you can email Alyssa. This is a NADAC credit information. In order to receive your credit, you must watch the program all the way through, even the Q&A section at the end of the presentation, and do not leave the console throughout the middle of the presentation. Please continue to stay onto the platform, and you'll be automatically redirected to the evaluation landing page. If this is your first time attending the webinar in this year of 2019, you'll need to create an NACCME account when you are first directed to the landing page. And for all subsequent webinars you attend, you will already have an account and you'll just need to log in. So after completion of the evaluation, you'll be able to download or print your certificate. And the NADAC credit is only offered for the live broadcast. Okay, so let's get to it. This is just the presentation title. So this is Treating the Addicted Professional, Practical Tools for the Discerning Clinician. And my name is Sarah, and let's go ahead and get started. So basically, just kind of starting off, I wanted to give just a little introduction to myself and part of the reason why I love doing this so much. And of course, I feel like Molly Shannon of Saturday Night Live definitely, can exemplify this. This stuff is so exciting for me. I love doing it. I've always been really interested in addictions. This is work I've been doing for about, I want to say about 15 years now. And so specifically, I've done a lot of work in the treatment of individuals within the professional population. And so in several different levels of care, from the residential and detox level of care to intensive outpatient and PHP, and also just regular once-a-week outpatient individual therapy. So I'm hoping that this webinar will be supportive when it comes to the clinician that is in all these different levels of care. I also have quite an interest in supporting clients that have illnesses related to emotional overregulation. So those are basically individuals who have, from a very young age or somewhere along the line, learned that they can control their emotions, and they can control them very well. And it worked in the short term, but then in the long term, it ended up causing more problems. And so you'll see many professionals that struggle with illness associated with overregulation, and we'll be able to go into more depth on how to support that specifically. I also have to mention that there have been many challenges throughout the course of my experience in working with the professional population. And I know that this sounds a little cliche, but also kind of helpful to remember that with every single challenge that I've had in working with this population, there has always been something that I've learned from it, always. It can be kind of intimidating at times, sitting in a group full of surgeons and attending physicians and lawyers and judges and all these kinds of things. But I've just noticed that over time, it just gets better and better. And that all of these challenges are in fact really helpful in helping to learn. Okay, so here are some of the different objectives that we're going to be going into depth on today. I mean, really just trying to focus on identifying some of the different personality and symptom presentations of the addicted professional population. We tend to notice that not as though all individuals kind of fall into this specific category, but there does tend to be trends that I've noticed. And so talking a little bit about that, we're also going to go into some conversation around the ethical considerations with treating this particular population. There can be a lot of things that come up surrounding how to report, how to talk about these sorts of issues, matters of public safety, and a lot of times it's not cut and dry like ethics truly is. And so we're going to talk a little bit more about some questions and recommendations surrounding how to work through ethical matters. We're also going to talk about, it's really important to ask specific questions of certain kinds of professionals that might walk into your office or walk into your program. So we'll talk about those specific questions that you need to ask. At times, I think that clinicians, for whatever reason, maybe they don't know, or maybe they're afraid, or whatever the reason is, won't ask particular questions of this client, and it'll end up causing problems later on, I swear. And so I want to be able to give you all information on specific questions that you might ask so that it's not something that goes to the wayside and doesn't get addressed. So those are questions that you might ask in assessments, when you're considering discharge planning, when you're talking about return to work, all these sorts of things. I'm also going to present different sorts of interventions and treatment strategies that you would use with the addicted professional throughout the whole continuum of care. So it will kind of just bring in specific, maybe different modalities, like this is a really helpful intervention that you can do in group, this is something that you can do individually, and that kind of stuff. So what do I mean when I say professional? It's really, really interesting. I used to work at a program that specialized in treating, it was called the professionals program, right? And so people would call and be like, what does this mean? Like, am I eligible to join this program? Have I met the characteristics that are needed, you know? And so really what I like to think of when it comes to a professional is the following sorts of characteristics. A lot of it being related to the work environment. So typically individuals within the professional population are within a work environment that's really high stress, high accountability. Usually there's some sort of higher education that's needed for a professional, whether that's a graduate school, law school, medical school, something outside of the college kind of experience, but that's not always the case. There are many individuals that come through who are, you know, have a college education and are also CEOs or CFOs or of the higher hierarchy when it comes to a company. So that doesn't necessarily need to be a case, but a lot of times it is. And this continues to be a very, very, very relevant part of the professional experience's identity involvement, and at times over involvement. Which basically means that, you know, like a lawyer will come in and will say, you know, you'll ask them why it is that they're here, and they'll start talking about work. I mean, like automatically, you know, and oftentimes there are a lot of negative consequences associated with that because maybe it's influencing the other areas of their life that they care about as well. There are lots of reasons how this develops and why it happens that we'll go into more depth on later on in the webinar, but I definitely noticed that an identity seems to be really formulated with the kind of work that they do. And so that's definitely something that needs to get addressed throughout the course of treatment. Usually professionals are working with other individuals, and oftentimes they're in leadership roles, you know, and so these are kind of the people on the upper hierarchy if you're working with attending physicians or lawyers that are partners, judges, you know, like these kinds of people are at higher levels, you know, which also means that maybe they're used to being the ones that make the rules. Maybe they're used to being the ones that can get away with breaking the rules because they're at such a high level. And so that's another clinical issue we'll get into, but oftentimes you'll notice a professional being in a leadership role. Oftentimes a professional will need to get some sort of licensure, you know, whether that's a medical license or a clinician's license, you know, for attorneys, they need to pass the bar exam and get sworn in. And so typically a professional will also have some kind of licensure, but as I mentioned, that's not necessarily with the schooling as well. That's not necessarily a common theme. And as I mentioned before, work is of value. It is definitely a value. This is something that these people care about a lot. And so you'll notice that with a person that comes in identifying as a professional. There's also perhaps a large time commitment. In Chicago, there are, you know, it seems like hundreds of big law firms. So these are hundreds of attorneys, you know, and it's a very cutthroat, zero-sum game. very, very competitive kind of environment. And it is very common for an attorney to come in to treatment and say, yeah, I've been working 80, 90 hours a week. That's just how it works. They'll come in at 7 in the morning and then stay until 9 at night, and that's just how they live their life. And so there's a huge time commitment for the most part. With physicians and people in the medical profession, it may look different depending upon who it is that you're talking to and where they are in their careers. But usually there's a significant time commitment. Another sort of question when it comes to being designated as a professional is the issues related to public safety. You know, that this really kind of, I think, focuses on the medical professionals in addition to maybe people like pilots or pharmacists or, you know, nurses, physicians, those kinds of folks. Has a lot to do with other people's lives are a part of their job, right? And they are supporting lots of different people with their physical and maybe perhaps emotional health. And so a professional might also be considered to have this association with the importance of public safety, which kind of leads us to our next slide related to the ethical considerations of working with this particular population. We could talk about the ethics of treating the professionals for a whole entire webinar, and I'm sure that eventually I'll create something like that. It is very interesting when it comes to working with them, all the different questions that might arise. So really, the main point that I want to make in this slide and for people to continue to understand is that you are not alone. Look into the different sorts of resources that are within your community, that are within your, I guess, like clinical network. And it makes dealing with the ethical issues that much easier. And I just want to say that, like, all in all, try to be creative, try to be curious, try to be interested in the different sorts of ways that you can receive support. This is not something that you should be doing on your own, ever. I'm constantly talking to other people about the ethical kinds of questions that come up. So let's just kind of dive a little bit into some of the ethical considerations which might arise. One of the first ones, that a question that we might ask in an assessment is, are you using substances while currently working? This can obviously mean something different to a lawyer than maybe it means to a surgeon, right? Like, it might be different for a nurse that's teaching classes as opposed to a nurse that's on like a palliative care cancer sort of unit, you know? And so we really want to consider the kind of work that a person is doing and how much influence they have on other people, how much they're working with other people and supporting other people. And a major question, an ethical issue that comes up is, are they under the influence while actually performing their job? There is an amazing Showtime series called Nurse Jackie, which I'm sure that many people have seen before, in which this nurse is struggling with opioid disorder and is diverting, or is essentially taking medications from work. It gets worse over time, obviously, as the addictive disorders do. And, and this is what's really interesting, I guess, about treating the addicted population, is that a lot of times their perceptions about how they're doing at work is very different than the reality, right? And so we need to be very meticulous about asking questions surrounding, are they under the influence while they are working, right? You know, a lot of times people will say, no, because I don't drink when I'm at work. Oh, but I did have 3 shots before I walked into work, you know? And it's like, okay, so really being able to get specific with those questions. And sometimes people are going to lie, obviously. That's a part of this process as well. So I find that it's very, very helpful to get releases of information and to be able to get access to as many sorts of things as possible. You know, a lot of times attorneys specifically will be kind of squeamish about releases of information, but, you know, that can be a limit that you set in therapy, that, you know, actually in order to treat you, I'm going to need to have access to other kinds of collateral information in order to help you. The question of imminence is very interesting, very interesting. You know, so are you putting anyone in imminent harm? The Tarasoff sort of guidelines that all clinicians are responsible for is like, if we receive any sort of word that a client is going to hurt another person, then that breaks our confidentiality. We need to say something, and we need to inform the person that is being targeted in addition to law enforcement, right? Like, that's what Tarasoff means. But then the question comes up, like, for instance, what if you are aware that you're treating a pilot and you're aware that a pilot is continuing to drink, you know, despite your recommendations that this person get help, despite recommendations that this person go into treatment and get sober, they're continuing to drink, and you are aware that they're actually flying under the influence. What do you do? You know, and so it's a really, really, really interesting ethical question. Would you break confidentiality in that case? I've talked to a lot of clinicians, and actually there was somebody specifically, and it's very relevant for that story that I just shared. What she presented to the client was, you know, like, I cannot sit with the fact that this is what it is that you're doing. I cannot sit with the fact that you are drinking and while you're working, and that you could be possibly putting many people's lives in danger. I have an ethical obligation to say something. And so you choose. You know, either you choose to go into treatment or get sober, or I will break confidentiality and I will say something to your work. I will say something to the airline, right? And this clinician said, like, I'd be willing to break confidentiality at that point and possibly get sued by you. But me knowing that I did everything that I could do in order to support the larger, you know, kind of for public safety purposes, I would feel better about that. And so I am willing to get sued by you in order to do that. It was a fairly bold intervention, but it actually ended up working. And she's been working with the addicted population for years and years. And so she was used to and knew the client pretty well, and so was able to pull something like that out. Something that I 125% recommend is that you get an attorney, and it's not somebody that, I mean, it's not like you need to constantly be in contact with this lawyer or anything like that, but being able to get an attorney who is familiar with supporting clinicians in the mental health field, and being able to call up this lawyer and ask questions about these things. I have a lawyer that I've done a lot of treatment of attorneys on the other side of things, but I do have a lawyer who I'll contact every once in a while, and he is totally understanding, and he does it for free. I'll just be like, hey, let me run this by you. What do you think? And that's another point that I was trying to make earlier when it comes to the importance of really looking at your resources and what kinds of information that you can get. This is one of them. You know, get a lawyer that is familiar with supporting mental health clinicians, and find somebody that you think would be kind of willing to talk about these issues. Also, if you have any kind of, and most of us do have some sort of malpractice insurance, there are a team of lawyers behind every malpractice insurance, and so you can always contact them and ask a question of your lawyer. And I have done it before, and I want to say it's at no extra cost unless you actually want to retain the lawyer. And so, but you can always contact and ask these kinds of questions. Another ethical consideration when it comes to treating the addicted professional population is the question of returning to work while also maintaining safety. You know, a specific question that comes up when it comes to the medical professionals. When they return to work, making sure that maybe they're not on the same unit where they were diverting medications prior. You know, maybe it's they're not allowed to work overnight for the first year or so going back to work. And so it really needs to be talked about, and we need to constantly be thinking about how to maintain safety for this professional as they return to work. You know, it's very common, especially in Chicago and probably amongst the attorney population in general. It is this work hard, play hard mentality. And I know of many law firms in Chicago that have a bar inside of the actual firm. where the lawyers will go to sometimes in between clients, and like this is the reality of the situation. And so trying to maintain safety while going back to work is another really, really important question. Another, I think, helpful recommendation when it comes to ethical considerations is to contact in Illinois, it's the Illinois Department of Financial and Professional Regulation, the IDFPR, which is basically the bureau that kind of runs all of the licensing of all the medical professionals and clinicians, anybody that might be holding a license. And so you can also anonymously contact them and ask questions about things, so you can ask questions of other clinicians, you can ask questions of a lawyer, you can ask questions of, maybe groups of individuals who are focused on this kind of thing. And so really just trying to be as resourceful as possible when it comes to the ethics surrounding treating this population. I just have to say really quickly before moving on that you do have to think. You have to consider before accepting this kind of client into whether it's individual therapy or your practice or your IOP or whatever kind of place it is where you're working and you're considering taking this client into your program. Is this something that you want to do? There are a lot of ethical questions to consider. There's lots of concerns. And so you just do need to ask yourself as being the clinician if this is something that you want to do. And it's totally okay. I've learned, one of the greatest lessons I've learned is that it's okay to be like, you know what, I'm not as familiar with treating, treating lawyers. I don't feel very comfortable seeing you. Let me refer you to somebody else who can maybe do a better job. That's totally fine as you're kind of learning what to do with this particular population. So I love that we ask big questions. Assessment is a really important part of treating the addicted population. And as I was mentioning before, if we don't ask some of these questions that are either hard to ask or that you don't know to ask, I promise it'll be an issue later on. I'll give a little story about that in a moment. But I find that when a client comes in for an assessment, it's really helpful to ask them, of course, where it is that they got your information. How did they find out about you? Did they find out that when I used to see clients in private practice, I would get referrals from an addictionologist in Chicago who specializes in treating professionals, and I would just know, okay, if he's sending me somebody, then that means that this is a person that's in a professional position, and then I'm going to have to ask these series of other questions. So it's really important to ask how it is that they got your information. Another important question to ask is obviously what it is that's going on with work. I think that it's by Joint Commission requires that we ask questions about work. And are there currently any issues with you potentially losing your job? Are there any problems with you? Are you on short-term disability? Are you on long-term disability? Tell me everything that's going on with work. And another important question to ask specifically of the medical population of professionals is, have you been diverting medications from work? And you ask it very directly like that. Have you been taking medications from work? And I think as clinicians, it's sort of like using your skill to, well, no, if a client says no, it's like, oh, but maybe the way that you said that's kind of interesting. What do you mean by the way that you said that? Those kinds of questions. So being very direct with them. Have you diverted any sort of medications from work? Because that could play a role in, reporting to the board, reporting to the medical board or to the nursing board, those kinds of things. And so, have you taken any medications from work? Another really important question that I don't think that we ask enough as clinicians, especially if there are issues surrounding work or problems with work, is, are you working with an employee assistance program? Really, really, really important. A lot of times, especially hospital systems, will send most of their, workers that they're concerned about to the employee assistance program. A lot of times, that's how it is that they're coming to you, or they might be coming to you from from like the HR from work. So how did you find my information is a really helpful question. It will also be important if a client is working with an EAP to coordinate care with them in order to, you know, support especially the kind of individuals that might have licensure issues. You know, another really important question is, are there any sort of licensure issues? Have you been reported? This is a really good question. Are there any sorts of problems with your licensure? Sometimes, so the specific kind of anecdote, I was working with a nurse a few years ago who was diverting from work. Her work found out about it, and she was fired. But she did not know if they ended up reporting. Usually in Illinois, what will happen, what hospital systems are encouraged to do, sometimes they won't, but what hospital systems are encouraged to do is when they have a nurse or a physician or someone in the medical field that is diverting medications, that they report that to the nursing board or to the physician's board or to whomever. In this case, it's the IDFPR in Illinois. But sometimes places of work will not do that. And so so basically with this woman, she didn't know whether they reported her or not. So what we actually had to end up doing is that I contacted her work and asked them, like, did you actually report her to the board? And they said yes. And it's like, okay, because the next step, at least in Illinois, and I apologize, I'm very specific to Illinois and what I know about. But in Illinois, there's lots of advocacy for medical professionals who have mental health or addiction-related concerns. And so there's a program that focuses specifically on supporting those individuals. And in Illinois, if a medical professional self-reports to the medical board or to the nursing board, to the IDFPR, and they get help, and they do what they need to do, and they maintain sobriety via, you know, like evidence and random urine drug screen monitoring, they don't have to have a shot against their license. Their license does not need to be suspended. And as we talked about before, having a license is really important for these folks. They need them in order to work. Working is important. So in Illinois, if a medical professional self-reports, then they can, and they get help, then they don't have to have a shot against their license. And so it's a really important question. Did you self-report, or has there been any sort of licensure issues? And, you know, in addition, for attorneys, there's a specific kind of process that they need to go through as well. So if an attorney is convicted of any sort of criminal offense, not if they're charged, but if they're actually convicted of any sort of criminal defense, they need to report that to the ARDC, which is the Attorney, I think, Registration and Disciplinary Commission, or like whatever, in any sort of state, the attorneys need to report it to their commission. And if they don't, they will certainly have their law license restricted or possibly banned, or they may even be disbarred. So understanding, does the ARDC know what it is that's going on? Have you actually been charged? Or have you actually been convicted or just charged? These are all really sorts of important questions to ask. Okay, so let's transition to talking a little bit more about how we approach treatment with the addicted professional population. And I like to think of this as, like, what do you bring to the room? What kind of presence do you bring to the room as being a clinician and supporting these kinds of folks? And here are some of the different, I think, like, characteristics to really hone in on while being a clinician. And the first thing I have to say, and all in all, the nutshell of this slide is, you know, balancing between being kind yet firm. Like, I'm always saying that that's something I'm constantly trying to do. I'm constantly trying to work on balancing these two things. And I think being an addictions clinician work, all of us are kind of trying to balance between those. And so I find what really goes pretty far with the professional population is being so curious. Like, oh my gosh, that is so interesting. Tell me more. Data mining, when it comes to, since work is such an important part of these people's lives, a common, I guess, intervention that I'll ask, especially maybe an assessment or towards the beginning of treatment, is like, Tell me what your day is like from the moment that you wake up until you go to sleep. I want to know everything. This can also, I think, helps with using their language, and which is really important for the addicted population. It's also, it might help you with metaphors. It might help you with all these other treatment strategies. So just being really curious and inquisitive, like, wow, what happens then? Like, oh my God, that must be really validating. That must be a lot of pressure for you. Oh my goodness, like you being at the top and being this leader must mean that you're kind of constantly thinking about supporting all of your employees. Like, that must be a lot of stress. And so being very curious, being inquisitive, another exceptionally important quality to have, I'd say, an approach to take in working with this population is being confident, being as confident as you can. The way that I like to say it is, even if you aren't confident, act like you're confident. It's the common, I guess, idiom that they use in 12-step is like, fake it till you make it. Act confident even if you're not. Go in there straight, make sure that your shoulders are square to the person, making eye contact, act confident, exert your voice, these kinds of things. It's really important. I notice that the professional population they'll test you on that, So acting confident, even if you're not, that's okay. Also, we do need to remind a lot of these professionals that because work is such an important part of their lives and identity is so over-involved with, their identity is so fused with being a professional, that they'll forget that they're the ones that are actually the patient, and you are the one that are treating them, and they are the patient. And this comes up so frequently within this work that they'll try to take on the role of what their work is while they're in the middle of group. So oftentimes when it comes to the group, if you have a lot of these folks together, I'm leading an aftercare group right now, and 75% of the group are attorneys, right? And like, they'll just kind of go off on their own little thing, and they'll be talking about all of these, like all this language related to being an attorney, and the other people are feeling left out and that kind of stuff. And so I think a lot of times this population struggles to remember that they are the ones that are actually the patient, or they are the ones that are actually the client. It's important for us to gently remind them of this situation, and that kind of goes into rules, especially for those professionals that have been so, effective at their work that they've climbed to the top. They may not feel like they are privy to the rules, like the rules might not be that important. A lot of times they'll show up late to group and wonder why it's that big of a deal, and so it's really important to remind these folks that just because, I think there's a really good scene in the Star is Born movie, where Bradley Cooper walks, I think his name is Jackson in the movie, he walks into the movie or into treatment, right? And he's late, and the clinician's like, you can't be late. Like that's how this works. You got to follow the rules. That you might have been able to get away with that out there, but you can't do that here. I think that's really important to communicate to them. I think it's also important, obviously, to be non-judgmental as much as possible. There's a lot of, I tend to use a lot of mindfulness and like present moment awareness exercises with professional populations. And so we want to be just as non-judgmental of their own experience as we expect them to be of themselves, and so really being able to describe what it is that's happening as opposed to leaning on judgment is an exceptionally important process within this. I also find that if you start conversations or interventions with like research says, so like research says that if you continue doing the same thing for 21 days at a time, that your brain will start to actually change and it'll become more of a habit. Like research says post-acute withdrawal symptoms typically stay around for maybe over a year, depending upon the kind of substances that you were using and the progression in which it took a hold. So any time that you might be able to reference research, anytime that you might be able to bring in an article, oh my God, they absolutely love it, So bring in anything that provides any sort of evidence. Obviously, specifically attorneys love that stuff. Medical professionals love it. any kind of person that's used to, any kind of professional that's used to looking at this kind of information in their professional world, it could be really important from a therapeutic perspective to give them all of this. I'm frequently for attorneys printing off research studies all the time. They just eat it up, absolutely love it. I think another treatment approach to take on it is sort of recognizing the cognitive styles of people that are within the professional population. There's a lot of rigidity. There's a lot of A plus B equals C. Like, why would you think anything else, you know? And so being able to, I guess, like, encourage flexibility is an important part of the process, but just keep in mind that at times we're going to have to sort of go along with the way that they're thinking for a little bit, you know, build that rapport, build that relationship, try to understand, be curious, and eventually kind of you can start to chip away a little bit more, start to challenge that kind of rigid cognitive style. But in the beginning, that will certainly be an approach that you want to take, and just be really curious about that. So let's get into some of the specific treatment interventions. I am a true to form acceptance and commitment therapy and dialectical behavioral therapy clinician. However, that does not mean that only these sorts of interventions are going to work with the professional population. I just noticed time and time again that they're particularly helpful. Acceptance and commitment therapy, for those of you who are familiar, is a kind of therapy that focuses on the importance of increasing psychological flexibility, and the theory of dysfunction being that the way that, well, I'll kind of go back a little bit, that we as people, that language essentially causes suffering, and that oftentimes, but just based upon the way that our brain thinks about things, that our brain actually, it's meant to help us, but a lot of times it gets us into trouble by trying to control our internal experience. That, without a doubt, happens with so many people in the professional population wanting to control, right? Like really wanting to control their internal experience, struggling to realize that there's only so much that they can do. So that's why I find that that ACT is very helpful. And so any sort of intervention related to willingness with clients with professionals, I find can be very helpful. These people are by nature problem solvers, and they've taken those same kind of ways to try to problem solve the external world to try to solve their internal world, right? If I'm feeling anxious, if I'm having nightmares, drinking just makes sense. That's the next right thing. You know, if I have physical pain, I'm a nurse, I have physical pain, I'll just take medication. That's the next right thing. And so it's very important to kind of understand that process and to communicate to clients that the problem solving only kind of gets you so far. It's a short term, it helps in the short term, but then ends up making things worse in the long term. I find a really helpful metaphor with willingness is an ACT is called the uninvited party guest, and I'll do variations of that particular metaphor, but basically it's like you're having this party and you invite somebody you invite all your friends and family, people who you love, but there's this person there that you did not want to be there, and he's gross and disgusting and is really embarrassing, and you just want to get him out, but you go to kick him out, but then every time you kick him out, he keeps on coming back and coming back and coming back. And so you eventually try to problem solve, and you're like, okay, I'm just going to stand at this door and make sure that this guy doesn't come in and ruin my party. But while you're standing at the door, I mean, he's probably not going to come in, but while you're standing at that door, you're missing the party, you know? And so that's kind of connected to values, and which is kind of, I think, a really important part of ACT is getting people to understand the discrepancies, perhaps, the discrepancies between how it is that they live their life and what it is that they care about, and the difference between those two things. Oftentimes professionals will say, drugs and alcohol never influenced my work. It was fine. I never let it get that far. And then throughout the treatment process, when we do more values kind of exploration, they get to the point of realizing like, oh yeah, I mean, I guess even though I didn't show up to work under the influence, or at least I didn't think I did, I was still inebriated from the night before, right? And so It's being able to find those discrepancies is really important. I find that the 80th birthday intervention is really helpful for professionals. So imagine that it's your 80th birthday party and all the people who love you are there, and they're passing around the microphone and talking about how you've lived your life. And they're saying all these great things about you. What are you wanting them to say? What do you hope that they say? That can really help a lot to verify or to understand values, especially outside of work, which connects to the self as context. Self as context, the theory of dysfunction is that we can become so fused with the thoughts about who we are as a person. You know, so like I am a lawyer, I am a doctor. So that if anything disrupts that process, it creates a significant amount of psychological distress. And so it's important in self as context to remind this person that not only is there more to you, but there's also a part of you that exists that's separate from all of those things. Some of the related metaphors are the chessboard metaphor or the house metaphor. You can easily kind of look those up, what it is that, you know, like how to explain that. But I find that that's really helpful for professional populations to understand that there's more to you besides work. You know, there really truly is. Let's talk about that. Let's talk about what else it is that's going on. I also find that diffusion is a very helpful strategy to use with the professional population. This is based upon the theory of dysfunction, sort of similar to CBT, that part of the problem here is that we as people could get so overly connected to our cognitions about ourselves, about the world, that we don't realize that what we're dealing with is just really bits of language. And we're really asking ourselves, is this workable? Is this helpful? That's why the psychological flexibility is so important. Like, can I have a thought that I'm a piece of crap physician, right? Can I have the thought that I'm not good enough and be able to hold it differently and be able to have it outside of me instead of being so much inside of me? Can I write it out? Can I create a different relationship with it? I find that the professional population tends to take thoughts very seriously. You know, I think, therefore it must be true. No, not at all. You can have so many different, your mind is constantly giving you thoughts that are helpful and unhelpful. And you might think that a thought is helpful, but now you're starting to realize that it's not helpful. Like, so for instance, I used to work with an attorney who really said, like, I am the best driver. I'm the best driver in the world. I can drive even if I've had 5 drinks. Yeah. So that's an unhelpful thought process to have. That's an unhelpful thought process to be fused to. So part of diffusion is helping clients to realize that, like, let's look at the workability of this. Is this really, does this help you? Does over-connecting to this thought actually help you live a life that you want to live? Or does it help to keep you limited? You know, does it get you into trouble from time to time? Let's really get into that. Let's look at the reality of what it is that's going on. I also find that exposures, it's kind of related a little bit to ACT and not so much, but I find that exposures are really helpful for the professional population, especially when it comes to this kind of high pressure, high accountability thing. Oftentimes professionals struggle with relaxation. You know, it's like I tell them to sit and meditate for 5 minutes and they're like, what? Meditate, sit there and do nothing? Are you serious? No, like, what's the point of that, right? And so a lot of times it's, well, why don't you try it out for yourself? A frequent intervention I'll do for the professional population is say, you know, like at work, I want you to find a place where you can go for 5 minutes and just focus on your breathing. Do that once a day. See how that goes. You know, and then oftentimes they'll come back next week and be like, oh, I only did it twice, but at least they did it twice, you know, starting to create more flexibility. So being able to support the professional population with being flexible within their area of work is really important. Okay, so other kinds of interventions I find to be helpful, of course, is related to DBT, dialectics. And I have found continually that clients in the professional world love diary cards. I'll go through, in a few minutes, I'll go through different diary cards that I tend to give to the professional population, but they'll just eat it up. I don't know what it is. I don't know if it's about, I think what it's about is just being curious surrounding data, you know, and like specific information. And diary cards are very useful in that they're highly structured, and that they give a person information about what it is that's going on in their emotional world, and what it is that's going on with behaviors, and how it is that they're using these different sorts of helpful strategies and skills to be able to live a life that they want to be a part of, right? And so that I had a consultant come in, and he had like 20 different like Excel spreadsheets that he was showing me about his diary cards. Like they just get so excited and jazzed about this. And again, you want them to start to be curious about their emotional world, since there might be so much involvement in their other world, and in their work world. So I also find that just the topic of dialectics can be very helpful for professional clients to understand. And so the theory of dialectics is that there's truth in all viewpoints. It also accounts for the fact that change is constantly happening, that we influence other people, that our behaviors influence other people, and other people influence us. We impact our environment, our environment impacts us. And so I find that getting into conversations about dialectics is very helpful for the addicted population, and starting to think about, like, oh yeah, how did my behavior of me coming in under the influence impact my coworkers? I don't think that it influenced them, but how might it have influenced them? So having this kind of conversation, I find, can be really helpful. The nature of radical acceptance being that we can accept that there are, that life is going to have painful events in it, that pain plus non-acceptance of pain equals suffering. I'll continue to say that to the population, to the professional population, like, how can we work on accepting, making room for, acknowledging your emotional pain? And then that's why I think that emotion regulation is so important for the addicted professional population. So, I mean, you would logically think that that individuals who are professionals know about their emotions, but they do not. When I was working at the professionals program, I would have an emotions wheel for every single person to check in multiple times throughout the group, because there is this kind of discrepancy between understanding what it is that's really going on for your emotions. A common intervention I'll give is, okay, check in on your emotions 3 times a day. Set an alarm. Check in 3 times a day. See how that goes. And so usually I'll go down to the bare bones when it comes to emotion regulation for professionals, like going into the model for describing emotions, talking about how emotions really only happen for milliseconds at a time, but then they influence the whole body. They influence your facial structures and your physical characteristics. I find that it's really helpful for mindfulness exercises for the addicted professional population to have them identify where they're feeling emotions in their body, kind of bringing in a little bit of the somatic experiencing stuff. But I find that is particularly helpful because it feels they're accepting their emotion, but by accepting, they're going deeper into it as opposed to avoiding and trying to escape. And so that I find can be really helpful. Also, I guess is something I find that addicted professionals will be very interconnected with the myths of emotions, and so the DBT, I guess, like handouts, the myths of emotions is something that I'll go into depth with them on, like, how are these myths of your emotional experience guiding your behavior? And they'll have a lot to say about that. And so here are just a couple of slides with the DBT diary cards that I like to give to clients. And you can always Google DBT diary cards and find different sorts of styles of them, but this is the one that I really like using. I find that it can be helpful. So this is the front of the card, and then this is usually the back of the card. I know that's really hard to read, but basically it has all of the different DBT skills and the different days of the week over here, and how often a person actually ends up doing that particular skill on each day. And they just eat up seeing all of the different sorts of categorizing and documenting. They just absolutely love that experience. Okay, so kind of getting towards the end of our presentation, I did want to spend some time talking about the importance of discharge planning, whether you're working with somebody in IOP, in residential, or if you're working with somebody in just regular outpatient therapy. We need to be thinking about discharge from the point of intake. And what it is that might look like for each person. in Illinois, and I know with other states as well, they have different sorts of monitoring and advocacy groups. In Illinois, it's called the Illinois Professional Health Program. And basically, this is kind of like a combo of an employee assistance program in addition to an advocacy and monitoring group. And so it is a requirement when clients come in to see me or come into our program that are specifically medical professionals, that they get involved with IPHP. It's really, really important, especially if there are licensure issues, for these people to get connected to any kind of advocacy group or monitoring agency. Sometimes hospitals will do monitoring themselves, but it's really important to keep in mind, especially with medical professionals, that like, what is the discharge plan going to look like? What is monitoring going to look like? In Illinois, if there's licensure issues and they get something called a care and counseling, which means that even if there was a shot against their license, that they're doing what they need to do in order to take care of themselves, then they still need to participate in an aftercare group for 2 years. That's for physicians. For nurses, they need to attend for 1 year. For pharmacists, they need to attend for 2 years. For physicians, they need to be sober for 5 years, and they need to be monitored in that way. And so the rates of recovery for medical professionals who have licensure issues is very high. And that's part of the reason, is that there's a lot of monitoring that goes on in order for them to continue on in the work that they're doing. So you also want to talk a lot about the return to work plan and what it is that is going to look like for this person. You know, like, are they going to be working? Want to make sure that if they're a nurse, that they're not passing potentially addictive medications that they used to divert. That's really fairly important. You know, if you're working with an anesthesiologist, it's unlikely that that person will end up not being able to distribute those medications, but being able to set up some kind of monitoring is also just very important. There will be a lot of letter writing for this population too. I'm constantly writing letters to the ARDC in Illinois, to the IPHP program, to the IDFPR, to the Professional Regulation Commission, and so the certification board, and so there's a lot of letter writing that goes into discharge and connecting with the licensure board. And then, of course, I'd love to, I mean, every time I do a presentation, I have to include a picture of a penguin because they're amazing, and he's kind of saying bye. But the truth is that you may not be saying bye to this person. There's a lot of work that goes into the discharge process, and you might be running an aftercare group with a client for years. You know, that I have people in my aftercare group that have been here for a year, you know, and they'll continue coming for another year. And so that's just an important sort of piece to keep in mind when it comes to working with the professional population. What does discharge look like? What does monitoring look like? How do I get this person to be connected in a way that helps with safety as they kind of move forward in their life? And so that goes ahead and concludes our presentation. I'm going to go ahead and pass it over to Chrissy for a word from our sponsor, and then we'll begin the Q&A.
Great. Thank you so much, Sarah. Join us in San Diego, April 16th through the 19th for Innovations in Recovery, Foundations Recovery Network's premier conference designed to help you create long-term sustainable health for your business and patients. With up to 20 hours of available CE and CME credits, panels, and presentations from the industry's leading experts and thought leaders, as well as opportunities to network with referral sources, IIR is a powerful investment towards the health of your organization, career, and patients. Clinicians can receive a special rate of only $179 for a full 4-day registration. Go to foundationsevents.com/IIR for more info and to register. Thank you again, and I'm going to pass it back to you, Sarah, for the Q&A.
Thank you so much. Okay, and so the first question that we have is, which intervention or treatment strategy would you recommend is the most effective for the majority of the addicted professionals? Does it depend on the client's personality and the nature of his or her job? And the answer is yes, it absolutely does. I find that it's exceptionally helpful to use the client's language. As I was talking about with utilizing the ACT, I guess like treatment theoretical orientation, I find that metaphors, any kind of variation of metaphors that you can do with the client that brings in something related to their job is really important. You know, like I'll constantly talk about like motions for lawyers, like writing a motion and what that's like and how that relates to some sort of psychological kind of concept that we really want them to understand. I also, you know, it's great if I get a pilot in there, so it's just chock full of different sorts of metaphors that I might consider. But again, kind of what I continue to notice is that some really, really helpful treatment theoretical orientation is that of ACT and DBT, and specifically, I didn't talk as much about mindfulness, but I find that mindfulness strategies and present moment awareness is also really, really important for this population. And so any kind of time when they might be able to practice, or you can do it within the group or do it within an individual session, just like experiential is really, really important for these kind of folks to create more psychological flexibility. So doing mindfulness exercises in session, having them do exposures of mindfulness when they're actually at work, you know, like those are really important characteristics that you might consider. And then the next question is, do you think that there is a benefit in treating professionals in groups of their same vocation, or is it better to mix them in with other types of people? You know, I think that it's a really interesting question, and I'll say both. And kind of depending upon where they are in their treatment. I do find that having a lot of professionals in the same group at the same time is incredible for their own treatment process. They recognize that, oh yeah, like I could be a lawyer and I can also have a concern related to addiction, and I can also still be a person that I want to be. Like I could be a mindful and aware and present person and be sober, and this person is doing it too. So I think that there's a lot of, I guess, like healing that can come with that. And however, I also think that at times, you know, I remember working at the professionals program, I would have, you know, like nurses in a group, I would have attending physicians in a group, I'd have residents in a group, I'd have pharmacists. And you know, what was really interesting is that they would start to play out what it looked like within their work, like in the group, you know, like they would start to almost divide into these systems. The attendings tended to be very dominant, right? And the residents would sort of be like, yes, sir, whatever you say, sir. And the nurses would kind of chime in and ask like how it is that they can help. And in the therapy world, like we want to recognize that kind of stuff is happening, but we also want to help kind of devote these clients to thinking more about their life and their recovery on a wider scale. And I also think that it's helpful to have different people in the group so that they can understand that, you know, there's this book called The Brown Bottle, or The Big Brown Bottle, or something like that. It was distributed by Hazelden, and they like it's with this caterpillar that starts to become really interested in alcohol, or in this bottle, right? Because when he goes into this bottle, he feels really warm and fuzzy. And it starts off by saying, you know, like, this is a caterpillar like any other normal caterpillar. Like, you are a person, this disease looks very similar for most people. It just, you know, and so I think like helping maybe specifically like with the narcissistic client, like recognizing that you're not that special, you know, that there's actually like you can relate a lot to other people that are outside of your world. I find that can be very effective as well. So that concludes our presentation, and you can download the PDF of this presentation at a later time. And thank you all so much.